Welcome back to another episode of Quick Hits. I'm your host, Tyler Smith, joined by Ken Booth. Today, we're joined by Scott Becker of Becker's Healthcare in McGuire Woods. Scott's work is a big part of what inspired the Quick Hits format in the first place, so it's genuinely an honor to have him here. We talk about Scott's path from law to healthcare media, how he built Becker's Healthcare through grit, iteration, and great teams, and what he's seeing right now across the industry. From health system M&A and the realities of scale, to data complexity, AI adoption, and where leaders can turn information into action. We also get a preview of Scott's upcoming book, Building Great Businesses, Create Momentum, Overcome Setbacks, Scale with Confidence, which is available for pre-order now. All right, let's get into it.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler Smith. Tyler, how are you this week?
I'm great, Ken.
Good. Hey, glad to have you on as always. And we have a special guest with us this week. We are talking to Scott Becker of Becker's Healthcare in McGuire Woods. Scott, thank you so much for joining us here on Quick Hits.
Well, no, thank you so much for having me, and thrilled to get a chance to visit with you folks today, and just a pleasure, Ken, Tyler, and I know Brooke is in the background, but thank you folks so much for having me.
Brooke does a lot of heavy lifting on the Quick Hits podcast.
Good to give her a shout out. Appreciate
Absolutely.
that. Yeah.
Thank you. And Scott, just, you were an inspiration actually for Quick Hits when we were kind of developing the podcast. You were one of the podcasts that Tyler was like, "Hey, check out Becker's," and kind of really helped us to determine what the Quick Hits voice would be. So special guest, really, truly. So thank you.
Well, thank you so much. And we, we're thrilled to get to visit with you. So thank you so much for having me. Thank you. Sure. So I would say not purposely, then intentionally is maybe a simple way of saying it. I don't think I've used that phrase before, but what happened, I was a young lawyer at a large firm trying to build a legal practice, and at some point I ended up specifically in a healthcare group that really dealt with hospitals and health systems, surgery centers, dialysis facilities, things in healthcare, physician practices, and so forth. And I had some good role models that were sort of developing client bases, developing businesses as lawyers, as really a legal business where you're representing people in the healthcare deal and regulatory world and so forth. And so going back about 30 years ago, in what would today be called thought leadership, I started a very simple, really originally a letter that I would send out to my contacts and clients about here's trends that we're watching in healthcare. And then it became a really small newsletter in a really small conference.
Mm-hmm.
And I did that for a period of time and started to convene a small conference around this stuff, really with the purpose of not developing a media business, but becoming thought of as someone at the intersection of healthcare and business and sort of understanding the healthcare ecosystem. And you fast forward then from when I started it to about 10 years later, we had started to develop a little bit bigger following for the newsletter. And this was 100 years ago, not really 100 years ago, but a long time ago, where not everybody was trying to be a thought leader. Not everybody was trying to be, in digital on the internet.
Mm-hmm.
And so it started to develop a following. We started to develop a small niche conference. The first one was around surgery centers, not around health systems generally. Today, our biggest events at Becker's are around hospitals and health systems and around health IT and those areas. Originally, it was around surgery centers, and it was about 8 to 10 years in where there started to be enough of a following, enough of an interest that at that point, I started to hire people full time into what became Becker's Healthcare, what really became Becker's Healthcare. And some of those early employees that started with me some of them started from their college like apartments. Jessica Cole, who's our CEO and partner and president, just were remarkable at being able to sort of organize and synthesize a lot of stuff that we're trying to do. So I was good on the content side and understanding sort of the overall, here's what we're trying to do. You talk about quick hits. Early on, we moved to what people think of as short form journalism, where people were getting a sense of what's going on versus trying to do deep research papers and so forth. And I had an experience with that too, because I would write deeper research pieces and three people would read them literally. And then we started to do short things that were more just, here's a sense of what's going on in the news, here's the business value that's happening. And people were much more interested in that than my deeper thoughts on research. I thought they were brilliant. Nobody else did. But so we ended up, at some point, really starting to build out what became Becker's Healthcare, a media company in healthcare. And that was original. We did have print magazines, but that was a very small amount of what we did. We had a digital footprint that grew over the years, newsletters, websites, and so forth, and then conferences. And over a long period of time, we clarified sort of what we're trying to do, what our intention is, and it was really to be deep in a handful of healthcare areas versus in like a whole dozens of healthcare areas. And Jessica and I, a long time ago, sat down and developed sort of a core strategy about what we're trying to do. And then, like with any evolution in business, there's constant iterations, there's constant things that you think are going to go that way and go a different way. But the first big pivotal moment was starting as a thought leader, then more importantly, 8 to 10 years later, deciding, there's something here and I ought to start hiring full-time people into this business. People talk so much today on X and other places about being a solopreneur. That's never been my experience. My experience is nothing great gets done without great teams and great talent and great people. So we were big on starting to build teams, and that was also just a huge pivotal moment in the growth of the businesses. But that was sort of the constant evolution on it.
It's really fascinating how you tell the story, because it has such even though you say not intentionally or not purposeful, but then intentional, but then it just arcs so nicely as you learn, and then it's like the growth mindset we talk about at HDM. The opinion pieces weren't catching on, but hey, there's something where people they just had a thirst for knowledge in this industry. I remember when I started 16 years ago, and it was like you had to read Becker's and you had to read his talk. Those were the only ways you could even get information about this industry. And so, obviously, huge thank you for all that you've done in building your company, because it hasn't just been an amazing entrepreneurial story, but it's provided so much more context for us all. And I know that maybe the moment of having only 3 people reading your opinion piece might have been not the hardest moment in the world, but would love to hear about some of those like really tough moments when you had to show true grit as you built Becker's.
Sure. So there's so many of them, and there's so many just evolution stories in every person's journey, whether their career, their business, whatever they're doing. I mean, for us, there were so many. When we first got started seriously, we were competing with a great print magazine, and I was self-funding. I self-funded everything for literally a very, very long time. And I was making a living, so I was able to self-fund, but it was still self-funded. And so when we first got started, the leader in the print business, a great publication, still a great publication, Modern Healthcare, in the general healthcare world, would be sending out 60,000 print magazines a week. And my early editorial team was like, and this was the world, this evolving, changing world from print to digital. They were like, well, if we're competing with Modern Healthcare, we have to do what they're doing. And what happens is if you're self-funding, literally I would have been broke in about 4 weeks, 60,000 issues a week, the printing, the mailing costs. Anybody that's been in the publishing businesses understands how expensive that stuff was. And so we had to make a pivot relatively early on that we just couldn't win in that. And so we had to try and win in digital. And I've got them someplace, frames of the original website, but the website was so rudimentary is before digital was a thing. So we had to make a choice by necessity that we're going to try and win in digital. And then we tracked the digital count, the website visits, the email opens, the email everything's for years and years till we finally sort of became the leader in that area and went that direction. But it was a lot of it's by necessity. And again, iterative learner. I'm an incremental learner. I've worked with some people that are so brilliant they can see 10 steps ahead of you. I'm not that person. I view myself as a quick mind and a smart mind, but I don't have that ability to see 10 steps ahead. And so it was always an evolution, and it's still an evolution. I mean, when we originally were in surgery centers, we expanded into hospitals and health systems in orthopedic and spine. Those are the two areas. In orthopedic and spine was so close to surgery centers that we figured that would be our real sort of like that would be our growth. That would be where we would really grow into. And of course, 10, 15 years later, even a couple years later, it was clear that the growth was in the hospital and health system market. And it's very easy to understand in hindsight because that was just a huge market. And it wasn't at the time overserved, of course. And there was just a thirst for information. And there's just a lot of people that need to, there's a big audience in the hospital market. There's a lot of people that need to sell into that market. So that became 90% of the company, the hospital and health system area. But again, I didn't expect that, but incrementally, one of the things that I am a preacher and a believer in is you double down on what's working,
Mhm.
great people, great areas, great customers. And as we at least understood, oh, there's really an opportunity here. We put more and more resources into growing and developing that part of the business, which has become 90% of the business. And there's just lessons in that for all of us. We talk a lot about doubling down on what's working. And when you find great people, you find every way to keep them and engage them and accelerate them and help them. And the same thing with great customers and the same thing with great areas. And so we talk a lot about that. And we talk a lot about entrepreneurs, people in their own careers, whether you're an entrepreneur or not, knowing what you're good at, knowing what's working, and doubling down on that, and having the discipline to keep on going back to that. I view it as a real important part of what we do at Becker's Healthcare. We try and serve our audience really well, so they keep, it's a very competitive world, that they keep reading what Becker's Healthcare does, they keep listening, they keep attending our events, and then we have to make sure that the people that pay the bills, the big companies that sell into that are getting value for that, that they're meeting the right people, that they're interacting with the right people, and so forth.
And speaking of paying the bills and financial items, and also now we've started talking about like large hospital systems. I'm going to go ahead and get us in a little bit to the, what you're seeing right now. There's a lot of M&A activity going on in the hospital health system space, as opposed to the organic double down growth. This is the inorganic combination growth. From your perspective, what's driving this wave, and what do you think leaders tend to underestimate when they enter these mergers?
Sure. So there's so many different pieces to that. There's one piece of the puzzle about what's driving it, which is necessity. So there's
Mm-hmm.
30-40% of health systems and hospitals that are below zero in margins, that are trying to make it work, but still really struggling. And a
Mm-hmm.
lot of those hospitals and health systems, a lot of them are very small, a lot of them are independent, a lot of them are rural, feel like they need to find an alliance partner or a dance partner. So there's
Right.
one part of it that's driven by need, and that's probably not the most exciting part to talk about, but it's real. There's another part of it that's built around scale and having enough scale to be able to do a couple different things. There's scale to be able to invest in the technology, the physicians, the staff, the things that you need. So you need enough scale to be able to do that, and there's got to be enough scale and to be able to take some risk. If you don't have a big enough balance sheet, you invest heavily in this tech or that tech, it doesn't go right, you're really in trouble. Or you invest in a service line, you double down on orthopedics, on cardiovascular, on oncology, whatever it is. And if you don't have enough scale and it doesn't go right, there's two or three things that happen. One, you need critical mass in whatever specialty you're trying to be great at. And that takes some scale, that takes some size, and to be able to invest in. And the cost, the shortage of physicians, the shortage of specialists makes those costs very, very significant. So you need some scale. And then you also need some scale because the people that you're contracting with are so powerful and so big that there's this need for scale. So I
Mm-hmm.
see part of this M&A activity is driven by that need for scale, the ability to take risks, the ability to negotiate, and to be able to be in the business. Part of it's driven just by necessity, by people
Mm-hmm.
that are struggling and have to do something. And there's different pieces of this M&A world out there in hospitals and health systems.
Well, let's talk about some of the challenges then, the other challenges. So you keep talking about like the scale, the massive scale. So obviously with that scale comes huge amounts of data, and we're talking organizations that have legacy systems. They have systems that were not built to talk to each other. Some of them are proprietary, et cetera. What are the risks and opportunities that you see when these organizations put in the effort and make the investment to bring those systems together?
Yeah, no, and we've seen a lot of that. I think over this last year, UPMC went all in on one system. I think I'm right on that's the system that one of the big systems that did it. Many systems that have come together have multiple different legacy EHR systems, multiple different legacy data systems in a million different ways. Obviously, you folks live in the data business in a way that I don't. But one of the phrases that's been used the last couple of years that I'd never heard before was this concept of a data lake. How we take all our data and putting it in one place so it could be useful for all these different sort of apps and things that we're trying to do. And that just wasn't even a term, at least to people that are not tech savvy a couple years ago. But yeah, you still have huge systems that are running multiple different systems. I mean, they're trying to get to one system, and they can never be at one system because there's always going to be specialty systems in certain areas and so forth. But you do see people very much trying to be Epic first, Cerner first, whatever it is first. There's different, obviously, some systems that are still Meditech first or other systems first. Lots of great systems, but you just have this incredible complexity when you've got so many different systems going. It's almost like in any, in a typical health system, there is no typical health system, might have 10 enterprise programs and 1,000 to 2,000 apps or modules running or different areas running. And most people want to constantly sort of narrow that down just because there's more cyber risk, there's just more management challenges. You have people that are trained that live in Epic or live in Cerner or live in this or live in that, and unfortunately, a lot of those people are not cross trained for the other. So when you're maintaining multiple different systems, you're maintaining multiple different staff technical knowledge too, and ability to manage stuff. And technology's hard enough. When it's hard, it's really hard, and it's hard enough for everybody at every level of a system to use. I had a conversation the other day with somebody about this concept of enterprise AI solutions versus the one-off solutions. So many of us are, of course, everybody should be or is dabbling in how are they using ChatGPT or one of the different, whichever one you're using as part of their daily workflow and what you're doing. And of course, I've leaned into it. I find more and more use cases for like, okay, I'm doing a podcast with somebody, I don't know them at all. Can they create 10 questions for me? And what used to take me a lot of brain effort now can be done in 30 seconds, and it's great. And there's a lot of those little use cases, but those use cases with individual one-off use cases are very different than enterprise use cases. And how to get those enterprise use cases to cascade through a system, it's really challenging and a really big deal.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show.
If we can dive into that just a little bit more. So certainly, yeah, we know that AI was just a buzzword for a while, and a lot of companies are like, yeah, we're adopting AI, just to find out that, yeah, it was little things, little, emails, it was responses, it was chatbots, things like that. It wasn't something that was really enterprise worthy. But then we see the emergence of agentic AI and really going through the work of configuring and prepping AI to deliver reports, et cetera. Have you, in your experience, have you recently spoken to any leaders or healthcare organizations that are leaning into the agentic AI, kind of like the next evolution of that?
I mean, very much so, very much so. And it's very much this discussion about it being a cascading type of thing. Forgetting which health system executive I was speaking to the other day on this, about going from individual use cases to enterprise cases to agentic cases to really, not just individual uses for the 10,000 employees, but how do we systematically use it more fully? And there's,
Mhm.
they're different. It seems to be a cascading type of thing. I mean, you obviously are seeing it more and more with the ambient listening and going right into medical records and going right into other things. That's been a huge wake up call and evolution just over the last couple of years. It seems like a race to really be using ambient listening very fully. Then you've had other places where in the accounts receivable, revenue cycle area, there's been a lot of use cases for AI for the last 5, 7 years or so, and improving and escalating. Not necessarily end-to-end solutions, but solutions that really take part of either a good part of the revenue cycle and try and take some of the hardest to fill labor positions out of the needs. So you're really tearing or tranching what really has to be done with a different level of oversight. But I see sort of different cascading use cases, different systems really diving into it more deeply. And this is another issue of scale. You can't afford to do these things. You can't, because they're not just technology solutions, they're people and change management solutions. And you can't manage through these things well without having some scale to figure out where they're going to apply and what they're going to do. And the use case differences at a 5,000 or a 100,000 person system are very different than at a 1,000 person system.
Yeah, and it's funny because then you pair that with your talk about building a company through bootstrapping, and I was thinking about it, I was like, well, hospital systems haven't been built through bootstrapping probably since the 1800s. So it's like a mindset that they haven't had to have. So they've always relied on scale, and now if the scale you need has to be so massive, then there really can only be so many players in each market for the amount of patient, for the patients. And yeah, I'm glad we talked on ambient. I'm glad we got to AI, and we've had a couple episodes where we talked about data lakes. So it's always nice to get into that. Is ambient the technology that you see that's really empowering providers and patients right now, above all other pieces of technology that are being implemented?
I don't know if it's the one that's empowering more than any others, and there's so many different evolutions going on right now. But I think it's very important. Like you can't hear a health system that's starting to use it, that's using it more and more, that's not pleased with it. That's actually, it's not perfect, but it's not like, if you're, I am older than you folks, but 100 years ago, we tried to dictate through Dragon Naturally Speaking, which is a program 100 years ago. And when you first used it, it was really challenging. It would get every one of two words would be wrong. And the difference in technology today versus 20, 30 years ago and the ability for the ambient listening to work, I think it's one of the pieces that's front and center because so many people are using it and investing in it and finding that it's helping them with one of the most critical issues, which is burnout of nurses and doctors and time that people have to spend doing record stuff, after at the end of the day. So we hear it constantly, and it seems like there's a race to be in that game. I mean, the other thing that there's always been a lot of administrative areas that have been ripe for artificial intelligence and are moving in that direction. I think the bigger challenge that people are trying to figure out is this, doctor shortage problem. We've got this horrendous physician shortage problem in our country that is leading to multiple tiers of the healthcare system, and it's going to get worse. I can't see how it doesn't get worse. And I don't think AI is going to solve all that. There's this I think false belief by some people on the internet that we won't need doctors because AI is going to take care of it. I just don't see that being the case at all. I see it being trust but verify. We're going to need AI plus physicians, but the evolution of use cases where artificial intelligence can be really helpful for a doctor or in some places help with the diagnosis, help on other things is really important. And the challenge, of course, is in certain areas, as a physician, you have to be yourself so smart to figure out how to use these tools and use them well and filter through what is really the right thoughts, the wrong thoughts, and so forth. So I think it's a really evolving and interesting, time with that. But I think the big hope is that there will be great hope on it and help on it on the clinical side. And I don't think it's replacing doctors at all, but hopefully it makes doctors' jobs a little bit easier because we're just at a horrible spot in terms of access and physicians in our country. That's tending to get really worse in a short period of time.
So is that, would you say, the most critical challenge that's facing leaders right now? Then is just that resource, and then kind of that bottleneck of physicians.
I think I put it right up towards the top of problems. I think like in the beauty of healthcare is the beauty of you, me, Tyler, Brooke, we are all patients as well. So one of the things that's beautiful about healthcare is somebody could tell you there's not a shortage, there is a shortage, but it and all of us are in probably commercial plans of some sort. We probably have better access than the average person in America. But when you need a surgeon, an oncologist, a doctor of any sort, and this is what a problem we have in our country is that when we need a problem and we've got commercial insurance, we have a hard time finding the right person for the right thing. And if you might not in a metro area, if I need a knee surgeon, not that hard to find. If I need a really advanced oncologist in a certain area, hard to find, hard to get the right person. You need to know somebody. It's not the same in every specialty. If you need a new psychiatrist, a new primary care doctor, really challenging. There's places in Minnesota, one dermatologist for 500,000 people. In Texas, one neurologist for 500,000 people, and there's just this huge growth of skin cancers, neurological disorders, dementia, Alzheimer's. So this problem of I don't know if it's health systems are trying to figure out I think the old adage used to be hospital administrators that would love being a hospital administrator if they didn't have to deal with doctors. You follow me? But there's a guy who used to make a joke about being a lion tamer. If you were a lion tamer and hated lions or scared of lions, you shouldn't be a lion tamer. And similar to that. But I think people would like to see, is there a way to do this without doctors? I don't think there is, quite frankly. I think we've got to have both great doctors, advanced PAs, advanced nurses, and to go with the technology to make this all work. And I think what happens is you could have all this talk about, oh no, there's enough of this, there's enough of that, until there's not. And when you need an oncologist in a certain specialty, we've seen this over the last few years, there's just not enough oncologists in certain specialties to take care of people. It just doesn't work. You've got labor and delivery units all over the country closing down because there's just not enough obstetrician gynecologist. And there's ways to sort of try and mix that by having others deliver babies in smaller communities, but it's not a good answer because what happens as soon as there's anything challenging or more problematic, you need backup of smart physicians, men and women physicians that can actually deal with it together with nurses and advanced practitioners. It's not just doctors, but it's the place where often we see the most glaring problem.
It almost seems like we shifted from there was AI being developed, then there was a fear of AI, and then there was the adoption of AI, and now it's like AI is going to solve everything. And to your point, Scott, like when we've talked to some folks it's like it is on the diagnostic side, it's moving fast. Like folks love ambient, but then you would think where on the back end it would be faster. The improvements aren't full, like as you were alluding, it's not fully there on the administrative or financial side, where you would think that seems to be the inputs are cleaner and easier to build labor fixes, if you will. So yeah, I don't know where I lie, but it's always great to hear where people go on the prediction curve on what's actually going to happen in the next 10 to 20 years.
And I am a believer that there's a lot of countries that move fully towards preventive medicine, and the biggest countries that move fully towards preventive medicine have disasters whenever there's a problem. On its face, it all sounds great. We of course need all the preventive medicine. We need all the AI,
right?
But we better have doctors and nurses just in case. We better have both. And you've seen it. I don't know, anybody that's is an adult has seen friends die of cancer or heart disease, and heart disease might be easier to find the cardiologist, cardiothoracic help. Certain oncology specialties, it's very hard to find the right oncologist, and the oncologists are just overwhelmed, literally. So trying to figure out, yes, different workflows, but I think you still need to have enough oncologists and enough people that really understand the stuff to really be able to help. And there's different ways of trying to get through that, but you still need, I think, the technology plus the clinical judgment plus the person to help manage through this stuff. But we are getting to spots where there are just deserts of doctors, deserts of oncologists, and it's going to get more challenging. And so you're going to find different ways to do it through leveraging advanced practitioners and nurses and others. But I think the right mix is some balance of the best and brightest of nurses, doctors, PAs, plus technology to take care of people.
And so you talk to health system leaders all the time, in addition to um, former presidents, athletes. But as we're talking about this problem, like the innovation really requires a growth mindset. And so as you talk to these different systems, like what separates the organizations that are continuously adapting from those that seem to get stuck?
Yeah, I think part of it is if you're a healthier system to start with, and you've got really good talent in leadership, and you understand what you're trying to accomplish, which is to be great in your area, great at what you do, have great physicians, great nurses, great teams, and to keep on investing in technology while you're doing it, it is much easier to stay a leading system and keep on being really good, or at least as good as you can be. Where I find amazing to me is I come across systems all the time that started as okay systems. And they've made that evolution from okay systems to really good systems over the last decade or two. And I find that to be really impressive. There's a system on the East Coast, Hartford Healthcare, there's a system here, Endeavor Health, that have really done a great job of going from like okay systems to really good systems over the course of the last couple of decades. And I think it takes tremendous leadership. It takes a tremendous board. It takes tremendous investment in talent, doctors, nurses, staff, and trying to really be good. And then you also have to make sure that you're really great at like any business. You better be great at a few things. And so I don't have an easy answer to it, but I'm really impressed. The effort here in Chicago, Northwestern, which is a great system, continues to double down on trying to be great. And it's not easy. And there's a lot of systems doing it, of course. I mean, there's a lot of systems doing it, but it's real hard work, and it's real hard work at a time when margins are challenging. So there's not that much room for error. I mean, you got to see so many systems in the country have some kind of strike going on, and the systems are working at 1 to 5% margins, and they're trying to deal with the strike, the challenges of course, nurse and staff and unions want to get paid well too. And you've got this really challenging situation because they got to be able to make a living. The system's got to be able to make some margin, and they've got payers that are increasingly quite powerful and very challenging. So I see there's a lot of stress in the system, and it takes constant effort to try and keep on getting better and to stay both clinically great and financially solid.
Yeah, and it sounds like so once you get there, once you have the momentum, just keep going. Do not take your foot off the gas.
I think that's right. I think you have to. I mean, it's very easy to go from great to bad. In a generation,
Mm-hmm.
it's not that easy to go from not so good to great. And I've seen a bunch of systems do it, and it's really impressive. And I see different systems in the country trying to do it, and it's really impressive. It's not easy. It requires a lot of and then you have people like Jefferson Health. They're doing a fantastic job of trying to put together the pieces they've put together and make them one sort of serious structure. What UPMC has done is remarkable. What Advent Health has done is remarkable, but it takes a lot of dedication and drive and really good leadership and really good people, and having clarity about what you're trying to do.
Well, and that's a great callback because we just had Luis Tavares from Jefferson on our last episode. So great to have that ability to drop that name. So Scott, yeah, I think we've done a really nice job. I think or you've done a great job of taking us through different parts of your career, then back to healthcare systems. Also, what the advice you get or the opinions you see from health system leaders. And we've talked about data lakes, we've talked about technology, but um, and I think like there's a lot of ways you've also alluded, financial, labor, but like where would be the biggest unlock if leaders could turn data into action in any of those areas?
Yeah, I think that's a great question. And I think, so much of it goes to ease of use. If somebody can't use a technology they're starting to use relatively easily in whatever position they're in, it's going to be hard for that technology to stick and really work. And then obviously with any technology that somebody's using, it's the constant improvement of the technology. Like we've served as an advisor over the years to software as a service and technology companies, and we believe that your job of improving the technology is never ever done. Your job of commercialization has to start early and is never done. But it's never, it's like Apple's on the iPhone 17, whatever operating system they're on. They're a great example of constantly improving. Epic is a great example of constantly improving. The dedication and drive that Judy Faulkner's put into building a team of engineers that are constantly trying to improve what they're doing. I remember so many times over the years where Epic had a specific module where people would say, well, that's no good. Somebody else has got a better point solution. But over the course of years, Epic would improve that module. And it's not that they're perfect at everything. It's a constant work. It's a constant work in process. But that dedication to constant improvement is real. With health systems, what I find is when they get things that are easy to use, that actually gives a nurse, a physician, administrative person a piece of information they could use now, they could put to work, that is great. That is great. When in the old days, you'd have scheduling systems, you'd have logistics systems that would throw at you a deck of paper or a deck of information, even if it was technology driven, and then the person using it has to sort it all out. And that's sort of like we used to, I'm a lawyer by background. We used to talk about people doing diligence on transactions. And if you did due diligence on a transaction and you gave the client a book of information, they would be like, you've not done anything useful for me. If you give them a 2-page memo that says there's 10 things you got to really worry about, now you've done something useful. And it's very similar in the technology world when you make it simple for the user to use and they can actually predictive analytics, telehealth was something people talked about for years. And of course, under COVID really took off. Predictive analytics was something talked about for years. And then it became a real thing when people were able to make predictive analytics systems and tools easy to use. Where it wasn't like you're giving me 10 things to think about. You're telling me you ought to move this to there because this is what's going on. So I think that end user mentality and really making it easy for it to use. And there's so many analogs in everything we do. We would have lawyers that would be brilliant but couldn't connect what was needed for the client. Similarly, technology people that are really embedded with the people doing the jobs are fantastic. Technology people in a vacuum aren't necessarily so useful unless you could really bridge that gap between what the user really needs and what the technology is. So for me, so much of it comes down to simplicity of use, and that might be oversimplified, obviously, in huge systems, but that's how we look at a lot of the stuff.
Scott, we could continue this conversation for at least another hour, but we really don't want to cut anything out of this conversation. So, just a couple of final questions for you. Loved hearing your experiences and your thoughts on the industry. But for emerging healthcare leaders, entrepreneurs, anyone that's listening to you right now, what's something that you wish that you had embraced earlier in your career?
God, that's a great question. That's a great question. I don't know that I've got a great answer to it. What I embraced early on, and I'm still a huge believer in, is that every business success is really built around building teams of people and great teams of people. And I don't think that's AI. I don't no. I adopted it fairly early. I'm not necessarily a believer in the solopreneur concept that people talk about. I think it's very hard to do anything really effective, really significant without teams of people. I think all the great entrepreneurs in the world, none of them did it alone. It's all teams. I just think you have to value. And the other thing I'm a believer in is with your teams, everything is a thrive relationship and not a top down relationship. So they have to thrive. You have to thrive. Someone who's doing one of the things I'm a huge believer in, and we use this phrase, love your 90 percenters. So you will have bosses that will pick on the 7% that a person doesn't do great. And I'm a huge believer if somebody's doing 90% great or 92% great, whatever the number is, you better love them. Better find a way to support and have them thrive. And it's a thrive culture. People should thrive individually great. The organizations should thrive. That overlap has to be aligned, but it's never going to be perfectly aligned because people have lives outside of work too. So you have to, like, yes, you're going to have a handful of people in driving any great organization that are pretty much 100% aligned, but most people are not going to be 100% aligned. You're going to be pretty aligned. And you have to learn as a manager, as a leader, to love those people, building organizations around lots of really good and lots of great people. And you better love them all and find ways to love them all. It doesn't mean everybody gets exactly the same everything, but you better
Sure.
find a way to love your 90 percenters.
That's great insight. Thank you.
So, Scott, what inspired you to write your new book, and what do you hope most readers take away from your book?
Sure. So the book is an iterative effort. So you have to bear with me in this, Tyler, because it's like we had done 100 years ago, we written some healthcare books that were healthcare, a mix of healthcare textbooks and healthcare area books, and they were real books. You know, as you're constantly looking at different challenges and so forth. A few years ago, I put together a book that was intended really to collect a lot of my thoughts on business and investing in one place, and really it was as much for like my kids, the people I work with, and for myself to be able to pull out where are those thoughts that I had on this or on this and on that and put them in one place. So I did this book a few years ago. The first version of the book came out so poorly that I couldn't send it out to anybody because it was sort of like there'd been a whole process in it. It had been a bit of a mess. It didn't come out how I wanted it to come out. So I literally had to pull the book. Then we did a second version of the book. That book we would call a D. The second version of the book we did was a much better version. It came out a year or two ago called The Entrepreneur's Edge. Still not great, but solid, but at least not embarrassing. Sent it out to lots of people. And one of my closest colleagues said to me, and this was really something. Like a couple of people said to me, "Oh, this is great. I love it." Another buddy of mine said to me, "It's good, but here's what you should have done differently." And so the first goal of the first book was to put my thoughts in one place. Now it's sort of there's this whole mix of, can I be in addition to healthcare thought leader, business thought leader, but the real goal of this all was sort of to become it's an iterative challenge. So I ended up one colleague's advice, then I got a professional sort of editor author's advice, and they said, here's what you ought to do if you want to make this book much better. And so we took book 2, spent last summer totally rewriting it, wrote it from scratch, and it's about 38,000 words or something like that. And it's concise, it's easy to read. It goes back to what we might have talked about earlier, where I'm a believer in short, easy to read, and it's 20 different chapters. Many of the chapters are relatively short, some are longer, the one on teams is longer, and so forth. But it's really an iterative effort to, yes, partly about being a business thought leader as well as being a healthcare thought leader, but a lot of it's about just the challenge of trying to improve upon it and make it sort of like make it actually good. And so, but this is how a lot of things I do that I work on. It's not like I came up with this book and it's great. This book I hope will be an A minus, a B plus, really helpful for people. It's not going to be like Peter Drucker or Jim Collins is good to great, but hopefully it'll be really useful. And we believe a lot of stuff is about, can you teach somebody something and can you entertain them? And more importantly, can you motivate them and inspire them to be like, oh, I should try this or I should do this? It's like people come to our conferences, they learn a little bit, they get entertained a little bit, but hopefully they go back to work on Monday a little bit more excited about what they do. And so my goal is the same with this book, that you read it, it's an easy read, you get through it, you say, oh, I could use some of those thoughts, won't use some of those thoughts, and so forth. It's like many things I do. It's an incrementalist effort. Like the first draft of many of my thoughts are embarrassing. By the whatever draft, we're at a spot where we actually can take pride in it, be proud of it. There's a whole game to this book distribution thing, which I've got an education on that is insane. And so, yes, we want each of you to pre-order the book on Amazon. It's called Building Great Businesses, Create Momentum, Overcome Setbacks, Scale with Confidence. I enjoy it tremendously. It's a challenge as well. I'm a big believer in that if you don't keep on growing and keep on thinking, you get old in a hurry. So for me, the process of getting back into really writing a book and doing it again, really taking what I had, but doing it from scratch for all practical purposes, I literally was really a great process. I had one of my editors at Molly Gamble, who's fantastic, help me clean up the when I had a first draft that I was at least comfortable putting in her hands. She cleaned it up. Then we went to professional publishing house. They've improved it, and so it'll come out in June. It's available pre-order now. It's Simon & Schuster's the distribution firm. It's a publishing company called Forefront Books. It's always one of these kind of things where I'm asking a million people to pre-order it. And so I hope that when they get it, it's a $22 cost. So it's not like nobody's breaking the bank, but it is, people are doing me a favor and pre-ordering it. So I'm hoping when so many people get in their hands that they're not like, oh my God, this is awful. So I'm hoping that people actually like it. And I think it will, the people that have read it so far, the advanced, not even advanced reader copies, the latest piece from the publisher, I've at least got generally positive feedback on, but you're always worried when you ask so many people to do you a favor and buy the book that they're going to get it and be like, oh, this sucks. So we're hoping that people like it.
Wait,
That's just the
so
reality of it.
All feedback is good feedback. But we're confident that it won't suck.
Within reason.
And I will clarify for everybody listening at home, Scott is not 100, even though he references back to a century ago. And if he is, he's discovered the fountain of youth. So send me whatever information that is.
It's a constant effort to try and stay reasonably healthy, mentally and physically healthy. It's a war.
Well, Scott, thank you so much again for joining us here on Quick Hits. This was an excellent conversation. You've given some incredible insights and even some inspiration for the entrepreneurs out there. So thank you again for joining. Really look forward to hopefully having you on again in the future. And we wish you success with the launch of your book. And can you say it one more time for our audience? And then we'll make sure that we link it as well.
Yes, it's called. Well, thank you so much. First of all, Ken, Tyler, Brooke, thank you so much for having me. What a pleasure. It's called Building Great Businesses, Create Momentum, Overcome Setbacks, Scale with Confidence. And we hope people enjoy it. We really appreciate you folks pre-ordering. I can't even tell you how much. Thank you so much.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.